So good evening, everyone. Welcome to Maa-Si Care Clinic's Q&A session on breastfeeding. Myself, Dr. Tanima Singhal, and I welcome you all. So you can start putting your questions in the chat box, and I'll start answering them. And hi, Lakshmi. Good to see you. Good. So you can start writing your questions in the Q&A box, and I'll start answering them. So let me see some questions in the which has been filled by you all. Till then, you can start writing your questions. So first question is from Sakshi Tyagi. My 3-month baby refusing to take feed. So Sakshi, if your baby is not taking feeds and the baby is 3 months old, is it because of low milk supply? Because you have not given any history that you are pumping or you are, what is the milk supply? So if your milk supply is low, then obviously the baby will refuse to take feeds. And if your feeding is good and your milk is good and you're pumping enough milk and still the baby is refusing to take feed, then the baby is habitual to the bottle, I suppose. Then we have to work in a way that we have to start working on getting the baby from bottle to breast. So because I don't have your history here, you have not mentioned anything. You just let me know whether what is the issue. Is your milk supply good or milk supply is not that well? That's why the baby is not latching. Next question is from Gitanjali. It has been 3 months since my delivery and my breast milk has reduced. Okay, so Gitanjali, always remember breast milk, if it is reducing after delivery, that means you're not creating enough demand. So if your baby is already latching on the breast, but you are still giving formula milk, then you need to latch the baby more frequently. And after feeding, you can pump for 5 to 10 minutes. So that will give an extra demand and the milk supply will improve. And if your baby is not latching at all, then you need to pump regularly to create the demand in the supply, which will improve the breastfeeding. And also you need to also see whether other things you are doing or not. So there are a few things which you need to work to improve your milk supply. Number one is hydration. Second is you need to work on your flow by doing oil massage and warm compress on the breast. Third are the galactogogues. So what galactogogues I prefer is lactomagic powder and Morrico tablets. And other than that, you need to keep the baby skin to skin with you. And also you need to keep a track of the baby's weight. Next question is from Neha Srivastav. I am not able to make milk to feed my baby who is 45 days old. My breasts are not producing milk. Please help me. So if your baby is 45 days old and you're not producing enough milk, I have just answered how to increase the milk supply that you can do. Next question is from Vasuki. Using formula but not want to switch to exclusive breastfeeding. So basically this looks like a low milk supply issue. So I've already answered about how to increase the breast milk supply. नेक्स्ट क्वेश्चन इज फ्रॉम रीना मिश्रा. मुझे बेबी हुए 1 से 1.5 महीना हो गए हैं. शुरू में 4-5 दिन 4-5 चम्मच मिल्क आता था. ब्रेस्ट में अब बिल्कुल ही आना बंद हो गया है. शतावरी चूर्ण भी लिया, मेमिकॉन सिरप कैप्सूल भी, बट कोई उसका असर नहीं हुआ. मेरी सी सेक्शन डिलीवरी हुई है. तो पहली चीज तो कुछ खाली खाने से मिल्क सप्लाई नहीं बढ़ता है. पहले तो अगर आपका मिल्क शुरू से ही 4 से 5 चम्मच ही आ रहा था, तो आपको फिलहाल अभी अपनी कंटिन्यू करनी है डिमांड क्रिएट करनी, जिससे मिल्क सप्लाई धीरे धीरे इम्प्रूव होगा. बच्चे को आप अपना मिल्क पिलाते रहिए. अगर उसके बाद आप बच्चे का वेट भी ट्रैक करते रहिए. फॉर्मूला मिल्क आप कितना दे रहे हो ये ट्रैक करिए. और अभी भी अगर आपका मिल्क में इम्प्रूवमेंट नहीं हो रहा है, तो आप टीम को कॉन्टैक्ट करके अपना कंसल्टेशन उनके साथ बुक कर सकते हो. क्वेश्चन लक्ष्मी का क्वेश्चन है, मैम माय बेबी हैज स्टॉप्ड लैचिंग नाउ. आफ्टर कंसल्टेशन सेशन विद यू आई रिसीव द मेडिसिन आफ्टर अ मंथ. Milk supply has completely stopped, so I don't get a drop. What should I do, ma'am? Soon I will have to join the office. What can I do, ma'am? So first of all, since you have taken the consultation previously, so whatever things I would have told you at that time, start doing them from tomorrow itself. You have everything at your place, start doing them. After 1 week of following everything, then just get back to me. Let me see what are the improvements, and accordingly, I'll change the protocols and we'll work on that for you. Okay? Okay. And don't worry that you have to join the office soon. So I will change the protocols in a way that you will be able to manage along with your office hours also. but start doing from tomorrow so that at least we can start the process, and after 1 week get back to me. Okay. नेक्स्ट क्वेश्चन, क्या अनम्यूट कर सकते हैं? मुझे बात करनी है आपसे सविता। आप एक बार पहले मुझे एक बार मैसेज तो करो बच्चा, पहले मैं देखूं ना कि अगर मैसेज में रिप्लाई करके कर सकते होंगे तो ठीक है, नहीं तो मैं आपको अनम्यूट करने के लिए अलाउ कर दूंगी। Rajita. Hi ma'am, my baby boy was 1 month old. I am suffering from low milk supply and milk supply was not enough for my baby. What should I take to increase my milk supply? So I have just answered. I am repeating it again. So all the mothers who are facing low milk supply issues, first of all, you need to work on the demand to improve the supply. So if your baby is already coming on the breast, but you need to give formula milk to the child, then try to frequently feed the baby, and after feeding, just pump for 5 to 10 minutes. That will help to increase the demand to get the supply up. And for other things, you should start taking good amount of water intake, improve your water intake. Second, improving the flow, do oil massage and warm compress. Now, how many times, that is a different question. That is a customized thing, but because I need to know the past history and the present history and accordingly advise you like how many times to do. And the other things is Galactovox medicine. So what I recommend is Lactomagic powder and Morico tablets. Along with that, you need to keep the baby skin to skin with you during feeding sessions. And lastly, you need to keep a track of baby's weight gain. So all these things you need to continue to improve your milk supply. And if your baby is gaining weight and you are seeing that there is an improvement in the milk supply, that is a good thing. You need to continue doing that. Next question is from Divya. I have a 2-month-old baby using formula. I have low milk supply, but it's improving with Lactomagic and Morico tablets. That's good to know. I pump after every feed, but I don't get enough to pump during night feeds. Will this affect my morning supply? Also, I do mid-bottle feeding, but when I take my baby for feed in the middle of the bottle, he's very fussy and crying and doesn't want to take feed. So I give him rest with the bottle. Also, I recently shifted from Paladai to bottle, which I didn't want to. Due to family pressure, I did. I have a feeling that he stopped feeding on me with interest after bottle feed. Not sure if it is a mind blockage too. Please advise. So let us talk one by one. So first you said that I have 2-month-old baby using formula. I have low milk but improving with Lactomagic and Morico. I pump after every feed but I don't get energy to pump during night feeds. Will this affect my morning supply? So what you can do, Divya, if you are not having enough energy to pump in the night, you can just hand express. Just taking out up because you're already breastfeeding the baby. Just hand express in the night if you are feeling too less in the energy to pump and get up in the night and pump. At least hand express that you can do. So keep a small bowl or a katuri in your bedside. And you in the night when you breastfeed, just hand express the milk in the katuri or the bowl and just keep it covered. So 3 to 4 hours, you can keep the milk at the room temperature. Next time, next feeding session, you can use this milk instead of formula if you are giving to the baby in the bottle. Second question was, I do mid-bottle feeding, but when I take my baby for feed in the middle of the bottle, he's very fussy and crying and doesn't want to take feed. So I give him the rest with the bottle. So here, what will happen if this will happen if your the flow, because both the bottle and the milk flow varies. So in this, what you can do, so first of all, change the bottle in a way the bottle should be the one where the milk is not flowing by itself. The baby has to make the efforts to get the milk. If the you can check it by once turn the bottle upside down. If the milk is flowing by itself, that is, it is a fast flow bottle. So you have to shift to a bottle which is a low flow bottle. First to shift to that. And second thing, before getting the baby on the breast, just massage the breast and like express little milk so that the milk flows in it. And once you shift the baby from the bottle towards the breast in the mid bottle, the baby will get milk immediately and the baby will adjust on this. Third was also I recently shifted from Paladai to bottle, which I didn't want to due to family pressure. I did. I have a feeling that he stopped feeding on me with interest after bottle feed. Not sure. So this will again be because of the same thing that if the bottle flow is very high, then the baby will not come on the breast in a better way. So here, just making a bottle which is low pace where the flow is less, that will help for you, Divya. So you can just follow that way. I hope this answers your question. If anything else, just let me know in the chat box. Rajita, hi ma'am, my baby boy was 1 month old. I'm suffering from low milk supply. I have already answered this. Okay, so I don't see anything new here. I'm just continuing with the questions which have been filled in the Google form which you all have filled. Next question is from Sureka. You can keep putting your questions in the chat box. I'll answer them. So next question is from Surekha. I can't give breast milk for my newborn baby. Reason is I don't have enough nipple on my breast. So this is a major issue there. So first of all, don't worry that nipple size and nipple shape doesn't matter if you have to give milk to your baby, because the babies don't need to feed from the nipple. The baby has to feed from the areola. So if the nipple size is small or flat or inverted, still don't worry. Just feed the baby in a way that you hold the breast and press the breast so that the areola pouts out and the baby will be able to latch with the areola. So this way you can feed the baby. Also, you need to do little warm or like oil massage and warm compress that will make the breast little soft so that the baby can latch on the areola. Next question is from Azma Tariq. I am using formula and wish to switch back to breastfeeding. So I have already answered about how to increase the milk supply. This you can follow. Next question is from Kaushalya. Baby is not latching properly because baby's mouth is small, and compared to before, now milk supply became very low. So first of all, for low milk supply, just follow the things which I have just told you. Or because if you are feeling issues with milk supply and the milk is not increasing, then please reach out to the team tomorrow and get your consultation booked. And regarding your baby's mouth is small, you can make the baby latch with a wider mouth. And how you can do that? When you are bringing the baby towards the breast, first tickle the nipple on the baby's upper lip. So baby will open a big mouth. Like first, initially the baby will open a small mouth. That time don't latch the baby. You just take the baby back and then bring again on the breast. So that way you will just stimulate the baby's your nipple on the baby's upper lip. So the baby will open a big mouth and then latch the baby. And once the baby is latched, don't remove your hand from the breast. Just keep supporting the breast so that the baby can continue having a good latch and a deep latch with this. Next, Kamal Sohal, low milk supply and baby is unable to latch because of short nipples. So don't worry about the short nipples. I have just answered that it is if it is flat nipple, inverted nipple, short nipple, don't worry about nipple, because a nipple's role is just to drop the milk in the baby's mouth. Baby has to latch with the areola and not the nipple. Next question is from Rohini Anand. Feeling guilty as my baby refuses breastfeed 6 months. So if it is a 6 month baby and the milk flow is less, then obviously the baby will not latch on the breast. So you need to work on your flow, the supply, and also learn the proper techniques for feeding a 6 month old baby. So Rohini, please don't feel guilty. Please reach out to the team tomorrow and get your consultation done as soon as possible. Next question is from Sunita. What's her name? Sunita Pagdala. Low milk supply and baby not gaining weight. So if you're on exclusive breastfeeding and still the baby is not gaining weight, then after every breastfeeding session, just hand express or pump for 5 to 10 minutes. That will give you more hind milk, which will help to and keep giving that milk to the baby, so the baby will start gaining weight. And also, if you're giving formula milk, then follow the procedures which I have just mentioned about increasing the milk supply. That will help. And if still you have already tried everything and still the milk is not increasing, then reach out to the team and get a consultation done. Next question is from Shikha. Latching issue because of inverted nipple and low milk. So don't worry about the nipple, because I have just shared that inverted nipple, short nipple, and those are not in a problem here. Bhumika Vigad, nipple pain while my baby is feeding. So if you're having nipple pain, that means the baby is doing a shallow latch. So to get a deep latch, then I just gave a solution how to let the baby open a big mouth. And you need to hold the breast in a way that the the areola pouts out, so that the baby, once the baby is on the breast, the baby can take a big bite. And also keep holding the breast so that baby doesn't leave the areola and come on the nipple. This way you need to work. Next question is from Lakshmi. Ma'am, my breasts are very small and too much soft. Does that mean the glands are very less in my breast and I won't be able to produce milk? No, it is not like that. So nature will never do anything wrong like this. So just keep trust on yourself, start the process as we just discussed, and follow for 1 week and get back to me. Let me see what are the improvements, and accordingly, I'll guide you on the next steps. Daman Kaur, sorry, I joined 5 minutes in the meeting. Can you briefly repeat how to increase the breast milk supply? So for breast milk supply, first of all, you need to work on the demand and the supply. So if your baby is already latching on the breast, but still you are giving formula milk, then start pumping after every breastfeeding for 5 to 10 minutes. This will create an extra demand for the brain to increase more milk supply. If your baby is not at all latching on the breast, then you need to pump. Now, how many times to pump and all those things that are very customized, because I don't know your history about all these things. So for that, you need to, if you feel you need to have a customized plan and a customized treatment protocol, then you can reach out to the team and get a consultation done. But the general guidelines are you have to increase the demand to increase the supply. This is the first part. Second part, you need to work on a few things like improving your hydration. For improving the flow of the breast, of the milk in the breast, you need to do oil massage and warm compress. Now, again, how many times? That is a like customized solution, which we need to understand first what are the demands and what is our target accordingly. And third thing is galactogogues. So the galactogogues, which I usually advise mothers, is lactomagic powder and Morico tablets. The dosage, again, the same thing, because the general dosage, I need to first understand and customize the dosage as per your past history or the present history. Along with that, you need to keep the baby skin to skin with you, and you have to keep a track of the baby's weight and how much formula you are giving with that. So if your baby's weight starts improving, that means your milk supply is improving. So this way you can track the progress. Nosheen. Hello, ma'am. I have a 3-month-old baby. I have fed breast milk as well as formula. From breast, he's feeling hungry. What do I do? So this means this is a low milk supply. Nosheen, I have just answered how you can increase your milk supply. You can follow that. But your baby is already 3 months old, so we don't have time to try different tricks and tips. So here I recommend you to reach out to the team and get your consultation done so that they can plan a customized solution for you, and you can follow that and increase your milk supply on a emergency basis, or like in a faster way. Shailesh Sharma, due to saggy breast, I need to support breast every time I feed my baby, and I want to boost milk supply as well. So if for saggy breast, if you feel that you need to support the breast, so what is the challenge in that? For if you have to support the breast, you can keep a small stool besides yourself so that you can keep your hand supported on that stool. So that is not a problem here. But if you feel still the problem, just let me know. And for improving the milk supply, I've already answered. So that way you can follow. Writing your questions in the Q&A box. Till then, I'll move the questions which were asked in the Google form, which you all have filled. Next question is from Ayushi Jain. Improper latching and pain in the breast while breastfeeding. So I have already told about how to get a deep latch to avoid the pain during breastfeeding. Next question. Mostly says low milk supply, or what I am seeing here. Anjali Suryavanshi says, my baby is not breastfeeding and I want to start it. So if you have to start it, first start the process of demand and supply, which I have already told, and work on the other methods, which I have told, to increase the milk supply. Jasmeet Setpal says, my baby sometimes doesn't take breast milk. So maybe the baby is not hungry that time. If the baby's, that's why the baby is not taking milk sometimes. So just follow the baby's demands and keep a track of the baby's weight. If the baby is increasing the weight regularly, then don't worry. Let the baby like relax in between, because as the babies grow, they have more gap during their feeding sessions, which is fine. Next question. Okay, just let me mute you. So, okay, let me see the other questions. Next question is from Hanu Darshini. Is my baby full every time my breasts are feeling soft, which means milk is there or enough for the baby? So first of all, don't have the notion that if the breast is feeling soft, I don't have enough milk. So softer breast doesn't mean that you don't have enough milk, or hard breast or leaking breast doesn't mean that you have a lot of milk. So first of all, remove that myth from your mind. So soft breast doesn't mean that you have less milk. it is perfectly fine, because in the initial days you might feel hardness of breast or leaking of breast, because that time milk supply is trying to be regulated. But once the body knows what is the demand of the baby, then you will not feel the hardness or the tenderness or the leaking of breast, which is perfectly fine. And about this, that increasing like the hardness of breast and leaking of breast, this is more common initial 4 to 6 weeks. Thereafter, many mothers don't feel the same, and it doesn't mean that you have a lot of milk, or previously you had a lot of milk and now it has reduced. It's not like that. Next question is from Shailesh Sharma. You have already answered about this. So, Savita, I have already answered, na beta? I am not seeing your new question here. Savita, put your question, copy that and again paste it, because I can't see your question there. Or how to do skin to skin in winters. Okay. So if your room temperature is good, like it is cozy, then you can do the skin to skin. But if it is too cold, then obviously you can skip this part. But whenever you're feeding the baby, just hold the baby very close to you. This is what you can do, Daman. Savita, I have not got your question. Please copy paste your chat. नेक्स्ट क्वेश्चन इज फ्रॉम अज़मा तारिक. मैम, मेरा बेबी 3 मंथ्स का है और वो लैच नहीं कर पा रहा है, बहुत ज़्यादा रोता है, तो मुझे फॉर्मूला मिल्क देना पड़ता है, उससे बेबी को वॉमिटिंग होती है एवरी टाइम. तो अगर बच्चा बहुत ज़्यादा भूखा हो जाएगा ना, तो वो जल्दी जल्दी दूध पिएगा, जिसकी वजह से उसको मिल्क बाहर आ जाएगा, क्योंकि बच्चा एयर बहुत सक करेगा. तो आप क्या करोगे, आप अपना मिल्क जब पिलाते हो, लैच नहीं कर पा रहा है, ओके, अगर बहुत लैच दिक्कत करे तो आप थोड़ी देर ट्रायल किया करो. अगर वो थोड़ा ही रोने लग जाता है, तो आप फिलहाल अपना मिल्क को पंप कर लो, और अगले फीडिंग सेशन में फॉर्मूला के साथ उसको रिप्लेस कर दो. तो अजमा, सबसे पहले आपको ये देखना होगा कि अगर आपका मिल्क का सप्लाई कम है या मिल्क का फ्लो कम है, तो बच्चा लैच करने में थोड़ा प्रॉब्लम करेगा. 3 महीने का बच्चा अच्छा समझदार हो जाता है, तो पहले आपको अपना मिल्क सप्लाई और मिल्क फ्लो पे काम करना चाहिए. और इसके बाद भी अगर बेबी लैच नहीं कर रहा है, तो हो सकता है आपका लैचिंग का पोजीशन जिस तरह से आप ट्राई कर रहे हो, उसमें चेंजेस करने की जरूरत हो. तो अगर आपका मिल्क सप्लाई कम है या आपको मिल्क सप्लाई अच्छा है लेकिन आपको भी इस पे वर्क करना है, तो आप टीम को रीच आउट करके अपना कंसल्टेशन लगवा सकते हो उनके साथ. अदरवाइज मैंने अभी मिल्क सप्लाई बढ़ाने के जो तरीके बताए, आप उसको ट्राई कर सकते हो. Deepika. Hi ma'am, I am exclusively breastfeeding and taking consultation from the team. My concern is till yesterday my supply was good. All of a sudden it dropped yesterday and baby was continuously demanding feed. I have been asked to pump after feeding that I could not do yesterday. Is there anything to worry? Okay. First of all, if it was just one day, then first of all, Deepika, don't worry. Once in a while it happens. And also sometimes what happens that if your sleep was not, like if your sleep was disturbed, or you were too stressed out, or you didn't have enough rest, then sometimes it happens. And also if your period started recently, then for 2 3 days the supply might dip, but once the periods are over after 3 4 days, the milk supply will be back to normal. So since you're already breastfeeding exclusively and it suddenly happened just yesterday, so just don't worry, just improve your hydration and the other factors which you already doing, and it will be all okay by in 1 or 2 days. And for this, next time what you can do, the days when you feel your supply is good, then you can pump the milk and keep this pump milk stored in your refrigerator. So the days when you feel that the supply is less, that days you can use this milk to supplement your baby instead of the formula milk. Next, you have asked that about what should I, what about the DOM style? And other question I have is, I pump post feeding, then next feeding baby demands generally within 1.5 hours. Will it be sufficient time to produce milk? Yes, it will be sufficient for that. So if your baby is gaining weight properly, so you have written about it also. Baby is 12 weeks old, birth weight was 3.12, current weight is 6.2. So 12 weeks, we need 12 to the 24, 2.4 kg in plus. So 3.12 plus 2.4. So this is 5.52 and your baby is 6.2. So your baby's weight is already very good, Deepika. So that means the milk which you are already producing is already on a good quantity. So the baby's weight is increasing more than what is required, but because it is exclusive breastfeeding, so I don't mind having extra weight with exclusive breastfeeding. But when you feel the milk is good, those days store the milk in the refrigerator and use them the days when you feel the supply is low. It happens because we are human bodies, we are not machines. Some days we might feel the supply is low. And regarding the medicine doses and all that, just have a call with your consultant, whomever you are consulting, and they will reduce the medicines for you. They'll give you a maintenance protocol on how to decrease the medicines. So whomever you are in the team, you're consulting with somebody. I think today's case was that I think somebody informed me in the same name, Deepika, that one of our doctor has an emergency. Her baby is not well. So we asked the mothers to shift to the other doctor. I think it is the same, but
Yes, ma'am. Yes, ma'am. I was the same. Yeah.
correct, Deepika,
Uh,
you are na?
yep.
So it's okay. Don't worry, Deepika. So you had your call done today.
Yes, ma'am. I had.
So she
Yep.
gave you the maintenance protocol, how to decrease the
Uh,
medicines.
no, I had. Ma'am has told me how exactly it has to be decreased, but she told me to have one more call
Deepika,
after
I'm not able
15
to hear
days.
you.
Ma'am has told me to have one more call after 15 days.
Okay, great.
Yeah.
So right now, because you felt that supply was little less, so she would
Yeah.
have given you right now to work on it. And after 15 days, she will start
Yes.
reducing the.
Yes.
Okay, fine. That's good, Deepika. That's fine. And the weight gain is very good actually.
Mm-hmm.
We have like little on a higher side. We are seeing the weight, which is very
Mm-hmm.
good. And this gives a very good information to all the mothers who are here right now, that with exclusive breastfeeding also we can increase the weight so well. That's good. So that's
Yes,
commendable,
and
Deepika,
ma'am,
and
one more thing I just wanted to
congratulations.
say on the call. I was actually typing the message, but I really admire you. And I don't know, every day I start with your video Q&A session, and I really look forward even the Friday's Q&A session. So great job, ma'am.
Thank you. Thank you so much, Deepika. It's all because of you all. You all just push me in a way that I feel like doing more and more work. So that's good, Deepika. And I'm so happy and so proud of you that with exclusive breastfeeding, your baby is gaining like more than what. And I'm happy because with exclusive breastfeeding, I'm good with the more weight, which is perfectly fine. And touch wood, it should keep increasing. And don't worry about the low milk. Sometimes it happens. So you can just pump the milk and keep it with you. Okay, so moving ahead, Lakshmi. How to increase demand and supply process, ma'am, since baby doesn't latch now. So you have to pump the milk. So if the baby is not coming on the breast, you try. But if the baby is not coming, then you pump. We'll discuss more on this, Lakshmi. Start following the things from tomorrow. We'll discuss our days. Kaushalya, ma'am, my baby is asking hourly feed. How can I plan pumping schedule? So if your baby is asking for hourly feed, then you can't pump, obviously, because the baby is frequently breastfeeding. So don't worry about the pump, Kaushalya. But why is your baby asking for hourly feed? Because if your baby is going through a growth spurt, so what are the growth spurt periods? It's 2 weeks, 6 weeks, 3 months, 5 months, 7 months. So if your baby is going through a growth spurt, then obviously it is normal for them to do a cluster feeding. But otherwise, if the baby is taking cluster feeding, this has to be worked upon, Kausalya, because why is the baby taking feeds every hour? We need to understand. Sailesh Sharma, how long we can keep pumped milk? Good question. So, freshly pumped milk can be kept at room temperature for 3 to 4 hours. If more than this you need to keep, then you need to keep the milk in refrigerator. In refrigerator, you can keep the breast milk for 3 to 4 days. And if you want to store it more than that, you can keep in the freezer. So, in freezer, you can keep it for 3 to 4 months. सविता, मेरा बेबी 2.5 महीने का है, फ्लैट निपल और हेवी ब्रेस्ट के साथ भी अच्छा वेट गेन हो रहा है और डायपर भी 6 से 7 चेंज कर लेती हूँ। अभी थोड़े दिन से हैंड सकिंग स्टार्ट किया है और 2-3 दिन से 3-4 मिनट ही फीड करता है और जब ज्यादा फोर्स करते हैं फीडिंग के लिए तो बहुत ज्यादा रोता है। ऐसे भी थोड़ा रोना ज्यादा हो गया है। 3 दिन से नॉर्मल इतना नहीं रोता था, बढ़िया खेलता रहता था। तो सबसे पहले देखो 2.5 महीने का है बच्चा ना सविता आपका, तो 2.5 महीने पे मैंने अभी बताया ना ग्रोथ स्पर्ट 3 महीने पे आता है, तो अभी 2.5 महीने के आसपास थोड़े वो साइंस दे रहा है। अगर उसका वेट गेन अच्छा है और आपका बेबी 3-4 मिनट फीड करके भी आराम से रिलैक्स हो जाता है और वेट देखो आपके बच्चे का वेट 150 से 200 ग्राम हर हफ्ते बढ़ना चाहिए। तो क्या करना है सविता, कल अपने बच्चे का वेट लेना, एक हफ्ते बाद दोबारा वेट लेना। अगर उसका वेट 150 से 200 ग्राम बढ़ रहा है तो चिंता मत करो, सब कुछ ठीक है, वो 3-4 मिनट में ही ब्रेस्ट को एम्प्टी कर लेता है। अच्छी बात है इसके अंदर सविता। लेकिन कल बच्चे का वेट चेक करो, एक हफ्ते बाद चेक करो। और जबरदस्ती उसको पुश मत करो, अगर उसका वेट अच्छे से बढ़ रहा है तो उसको उसको फोर्स फीडिंग मत कराओ, उसको डिमांड फीडिंग पे रखो। ठीक है। और जो अभी बोल रहे हो कि रोना अभी ज्यादा स्टार्ट हो गया है, पहले नहीं इतना रोता था, बच्चे बदलते रहते हैं, एक जैसा थोड़ी ना कि तुम चाहोगे बिल्कुल डिसिप्लिन बच्चा रहे, ऐसा नहीं होता। बच्चे ऐसे अभी वो ग्रो कर रहा है, धीरे धीरे चीजें देख रहा है, आसपास देख रहा है, कलर्स दिख रहे हैं उसको, उसकी विजन क्लियर हो रही है, उसका सुनने की कैपेसिटी अच्छी हो रही है। जो चीजें हमारे लिए रोज की हैं, ये कलर्स हमारे लिए रोज के हैं, ये आवाजें हमारे लिए रोज की, बच्चे के लिए ये सब अभी नया है। तो इसमें बच्चा कभी कभी इरिटेट हो जाता है, बच्चा रोने लग जाता है, तो ये नॉर्मल है। अगर उसका वेट गेन ठीक हो रहा है सवेता तो चिंता मत करो, सब चीजें ठीक है। प्लाज्मा एडोलैक प्लस देती हूँ अपने बेबी को, उससे वो वॉमिटिंग करता है बहुत ज्यादा, क्या मैं फॉर्मूला मिल्क चेंज कर सकती हूँ? देखो फॉर्मूला मिल्क के लिए तो मुझसे पूछो ही मत, मुझे तो बिल्कुल पसंद ही नहीं है फॉर्मूला मिल्क। इतना शुगर्स, इतना प्रिजर्वेटिव्स पड़ा होता है। ये क्वेश्चन आप अपने पीडियाट्रिशियन से पूछो कि मैं कौन सा फॉर्मूला दूं। मुझसे अगर पूछना है तो पूछो कि मिल्क सप्लाई के लिए क्या करूं, मैंने ऑलरेडी बताया है। और इससे ज्यादा हेल्प चाहिए तो टीम को रीच आउट करके अपना कंसल्टेशन लगवाओ, फटाफट काम करो और मिल्क सप्लाई को बढ़ाओ। मोनिका, मैम मेरा ब्रेस्ट फुल है कि, लेकिन मेरे भी एम्प्टी नहीं कर रही है, वो सक करने के बाद भी फुल ही है ब्रेस्ट। ये तो बड़ी अच्छी बात है। उसके पीने के बाद भी अगर मिल्क ब्रेस्ट में रह रहा है तो मिल्क को पंप करो और उसको अपने पास स्टोर करके रखो। कभी कभी ऐसा होगा, अभी देखो मैं किसको बता रही थी, दीपिका को बता रही थी कि कभी कभी ऐसा होता है कि हमको किसी किसी दिन मिल्क अपना कम लगता है, तो वो मिल्क को आप यूज कर सकते हो इसके अंदर मोनिका। अच्छी बात है, अगर बच्चे के फीडिंग के बाद भी अगर मिल्क ब्रेस्ट में रुक रहा है तो मिल्क को पंप करती जाओ और उसको ब्रेस्ट में, उसको फ्रिज में स्टोर करती जाओ। शैलेश शर्मा, थैंक यू सो मच मैम, यू आर मोस्ट वेलकम डियर। सविता, थैंक यू सो मच मैम, आपसे मेरी बहुत बड़ी टेंशन को दूर कर दिया। अरे ये तो बहुत अच्छी बात है सविता, मेरा काम ही यही है, इसीलिए मैं ये Q&A सेशंस लेती हूँ कि आप लोग को कोई स्ट्रेस हो, कोई डाउट्स हो तो वो हम क्लियर कर सकें। बहुत अच्छी बात है सविता, लेकिन कल बच्चे का वेट चेक करो, एक हफ्ते बाद चेक करो। अगर बच्चे का वेट 150 से 200 ग्राम बढ़ रहा है तो कोई चिंता मत करो। ठीक। मोर क्वेश्चंस, कीप राइटिंग, अपने क्वेश्चंस लिखते रहो, तब तक मैं फॉर्म वाले क्वेश्चंस देखती हूँ। फॉर्म वाले क्वेश्चंस में भी मोस्टली वही है, मिल्क प्रोडक्शन, लो मिल्क, लो मिल्क। वो उसमें से कोई एक्स्ट्रा क्वेश्चंस हैं तो मैंने ले लिए हैं। बाकी आप लोग के कुछ और क्वेश्चंस हैं तो आप चैट बॉक्स में लिख दो। आई थिंक मुझे अभी कोई नए क्वेश्चंस तो नहीं दिख रहे हैं इसके अंदर। आई फील योर क्वेश्चंस आर डन फॉर टुडे। दैट्स गुड। One more question has come. Haan, Lakshmi. Ma'am, can we mix all the pumped milk in a single bottle that is pumped at different time intervals during the day? Yes, you can do that. So what you have to do, don't keep the milk bottle in the freezer. You keep it in the normal refrigerator itself. So whenever you are pumping, you can keep mixing the milk into this. Don't worry that the temperature is different. Same day milk you can keep all stored in one bottle itself. And but second day when you are pumping and you have not used the first bottle, then you have to start a new bottle. So one day milk you can keep in one bottle, that you can do. While I pump, we might get 1 ml or 2 ml, so can we collect all the pumped milk? You can do that, otherwise 1 ml, 2 ml you can give it to the baby then and there itself. You don't need to collect it, so that you can give to the baby along with the formula milk, whichever you are giving, that you can do. Okay. Okay, so that's all for today. There are no new questions, and I've also answered the questions which were there in the Google form which you have filled. So that's all for today. Which pump do you suggest? Okay, so Daman, the usually pumps which I suggest is variable pump because that is easy. Because as the baby grows, you have a lot of works around the baby and you are not able to pump properly. So the pumps which I suggest is variable pump, and some of the common brands which people tell me is this Morrison, Bum to Cradle, Health Sense, and somebody told me recently True Mom. So all these 3-4 pumps you can try. They're all good. So you can opt for this one, variable pumps. They are good. They are like fairly good. So that way. मोनिका, मैम नॉर्मल बाहर नहीं रख सकते पंप मिल्क को क्योंकि ठंड बहुत है। अरे तो ठंड है तो क्या करो ना, अब थोड़ा सा पानी गर्म करके उस मिल्क की बॉटल को उसमें रख दोगे तो वो गर्म हो जाएगा। फ्रिज में रखोगे तब तो और ही ठंडा हो जाएगा ना भाई। तो अगर आपको जब बच्चे को देना है तो उसको थोड़ा गर्म पानी आपके पास हमेशा होता है। आप अगर बच्चे को फॉर्मूला दे रहे हो तो हमेशा आपके पास गर्म पानी रहता है। तो थोड़ा सा एक कटोरी में निकालो, उसकी बॉटल को उसमें रखो, उसकी गर्माई से दूध गर्म हो जाएगा, वो बच्चे को पिला दो, बस हो गया। ओके, ठीक, दैट्स ऑल फॉर टुडे। टेक केयर एवरीवन। सो आई डोंट सी एनी न्यू क्वेश्चंस and I've already answered. Okay, take care everyone. We will meet you again next Friday. Bye bye.